Hi everyone and good evening. Welcome to DBMCI and eGurukul discussion of November INI-CET 2022. And myself, Dr. Bharat Kumar VD, Pharmacology faculty, DBMCI and eGurukul. So before I begin, let us check the audio video is fine. Yes, hope so. It's fine. Okay, just put your messages, guys. If everything is fine, then you can proceed. Okay, just I'm checking everything is fine. Okay, can I start now? Okay, guys, so welcome back. Myself, Dr. Bharat Kumar VD, your pharmacology faculty, DBMCI and eGurukul. I hope the things have started now. Okay, so let us start the discussion of INI-CET, the recall based question. So you should help me in this to recall these questions. Okay, so please give your valuable inputs here and let me start. Question number 1, patient with erectile dysfunction was prescribed sildenafil. What is the mechanism of action of this drug? Now, please understand sildenafil basically is a phosphodiesterase 5 inhibitor. It's a phosphodiesterase 5 inhibitor. Now, what is the role of it? The role is, suppose whenever there is penile stimulation, there is release of nitric oxide. It will activate guanylyl cyclase, which will cut GTP, and you get cyclic GMP. And this is responsible for vasodilation, and that is going to cause the penile erection, which is sustained. Now, this cyclic GMP is broken down into 5-GMP, and the enzyme is called phosphodiesterase 5. So, these sildenafil, tadalafil, vardenafil, whatever the drugs we have, they inhibit the phosphodiesterase, and by inhibiting, they increase the cyclic GMP, and this is going to cause vasodilation in the penis, and that will be sustained penile erection. So the mechanism is not through IP3DAG, it is not through calcium, it's not through cyclic AMP. So the answer will be D, by increasing cyclic GMP. So if you know the mechanism, you can come back, still you can answer this is as cyclic GMP. So remember, in the exams, nitric oxide mechanism is commonly asked in your exam, so please keep an eye on that. Okay, so let me move on to the second question. A patient on ART after 6 months developed hyperpigmentation of hand and foot what is the drug responsible for this condition? So please remember, zidovudine mainly can produce nail pigmentation. So it can cause nail pigmentation mainly. And emtricitabine is the one which can produce the skin discoloration or pigmentation, and particularly in the sun exposed area. Sun exposed area. So this is the standard statement given in Goodman-Gilman. So since it is hand and foot, so what we can go with is emtricitabine that is going to cause this. So this emtricitabine is one of the least toxic anti-HIV drug. Zidovudine, apart from nail pigmentation, can cause bone marrow suppression, and also it can cause myopathy. Nevirapine is a NNRTI. So there is one more option which we didn't get. If you have that option, just you can message that option here, guys. Okay, so I will go with the emtricitabine. Considering they have given the pigmentation of hand and foot, so emtricitabine would be the answer. Moving on to the question, alkalization of urine leads to increase in excretion of. It's a general pharmacology question we have discussed a lot of times in the classes. So if you want to excrete an acidic drug in the urine, so what you have to do is alkalize the urine. So how do you alkalize the urine? By using sodium bicarbonate. So that will help. Suppose there is a poisoning with basic drug. The poisoning is with basic drug. So what you have to do is acidify the urine. So how do you acidify the urine? You have to use vitamin C, or you have to use something called ammonium chloride. So these will help. So it's a general concept. Alkalization of urine leads to increase in excretion of what drugs? Usually the weakly acidic drug, because when you place acidic drug in alkaline medium, the drug will be ionized. Ionized means water soluble. If the drug is ionized and water soluble, the drug is easily cleared out. So it is a clear-cut answer. It is weakly acidic drugs. Now match the following. So simplest options we don't know, but we can still match it. Imatinib is a tyrosine kinase inhibitor which is going to inhibit BCR-ABL kinase. Sirolimus is a mTOR inhibitor and we use it in drug-eluting stents. Trastuzumab is an inhibitor of HER2/neu which is used for breast cancer. Infliximab is a TNF alpha blocker, and major use of the drug is in rheumatoid arthritis. So we use it in rheumatoid arthritis. So this is the mechanism. Okay, I have given the directions here. Mechanism of the drug indicated in the image given below. So as most of the students have told, we have 3 drugs: nevirapine, efavirenz, delavirdine, and 2 more new drugs, rilpivirine and etravirine. NRTIs, we have zidovudine, stavudine, then zalcitabine, abacavir, lamivudine, emtricitabine, tenofovir. So they inhibit the enzyme reverse transcriptase. Then we have the drug integrase. So what is the role of integrase? To integrate the viral DNA into host DNA. If they have shown that in the image, so the answer should be tegravirs. For example, raltegravir. So the inhibitor of viral assembly. So viral assembly is done by the protease. So the inhibitor of protease, and they end with navir. For example, lopinavir, ritonavir, these drugs. So here they are given at the site of integrase enzyme. If they have given, the answer should be raltegravir. So guys, what do you feel? Is that the one which was given? So just tell me. So this is the one, integration of the viral RNA, then it becomes DNA. So here is the point that's shown, integration. So it is raltegravir. Tenofovir is a reverse transcriptase inhibitor. Then navirs are protease inhibitor. Lamivudine is also nucleoside reverse transcriptase inhibitor. So the answer will be raltegravir. Question number 8. A child presented with scorpion sting. Some told the BP was on a lower side, some told there was basal crepitus. And which of the following is the drug used in the management? So obviously atropine is not used, adrenaline is not used, the drug of choice is prazosin. So when the scorpion sting cases started in the beginning, so they used to give sodium hydroxide. The problem to give sodium hydroxide, you should give it in an ICU setting. So then they changed the drug of choice to prazosin, which is easy to titrate. So any scorpion sting, the drug of choice is prazosin, and it's a repeatedly asked question in an exam. So the answer is clear. Okay, so the answer is clear here. Question number 9. Peripheral blood smear showing the sporocyte of Plasmodium falciparum. We know that falciparum and malaria, they can produce recurrence, and they are also known to produce the cerebral malaria or complicated malarias. So they told the patient had a history of brief seizure. What is the treatment of choice? So this seizure will tell us patient is having the cerebral malaria. So whenever the patient is having cerebral malaria, obviously the drug of choice should be intravenous. So what we use is IV artesunate, that will be the drug of choice. So once the patient is stabilized, then we start the artemisinin combination therapy, which are given oral, that is later stage. So here, what is the preferred method is injection artesunate, because since they are given only artesunate in the option, so that will be the right answer here. Chloroquine will never work on falciparum in India because falciparum is acquired resistant to chloroquine. Doxy is not also the answer, and quinine is also not answer. So previously quinine was used, but the problem with quinine is hypoglycemia, then cardiac arrhythmias, diarrhea. So these were the things why IV artesunate is the drug of choice for the cerebral or complicated malaria. Okay. Please tell me if there are any changes, we can change it. Question number 10. Match the following with the drugs acting on them. So proximal convertible, obviously the drug which works is the carbonic anhydrase inhibitor, that is acetazolamide. So their main site of action is proximal convertible. Distal or the early part of DCT, the drugs which act are the thiazide diuretics, that is chlorthalidone. Then the collecting duct, the drug works as vasopressin group of drug, that is the desmopressin. The loop diuretics, they act in the loop of Henle, for example torsemide. So we have torsemide, bumetanide, furosemide, those drugs will act on them. So this is the answer for that. Okay, we have matched it. Second question, fourth choice was abacavir, very good. So second question, the fourth choice was abacavir. So remember, if the question was abacavir, remember abacavir main problem is it causes hypersensitivity. So once the patient develops hypersensitivity, you should never restart a drug. That is one thing they can ask in the future. And it has also shown to increase the risk of MI. So these are the basic adverse effects you have to keep on remembering. Again, the alkalization question. Alkalization of urine will help in maximum excretion. Which of the drug? Acetaminophen, paracetamol. So usually for paracetamol, we have an antidote called N-acetylcysteine. Salicylate, that is aspirin poisoning. In aspirin poisoning is a acidic drug. So what we do is we alkalize the urine so that the drug is ionized and easily cleared out. Another thing what we do in aspirin poisoning is we can also do dialysis and remove this. So it is one of the commonly asked question in our exams, and it's a repeatedly asked concept, guys. So two more options, if you remember, please tell me. You can put it in the YouTube channel, so we can go with that. It's okay. So it's important we learn the concept. True about memantine. So guys, even if you don't know anything about memantine, other options used as monotherapy, not in combination with ACE inhibitor. It is used with ACE inhibitor when the disease is not controlled. Even if you don't know anything, if you don't know the maintenance dose, nothing, what is true? Obviously, it's an NMD antagonist. That is the true statement. So sometimes if you know that one line also about memantine, I teach in my class memantine for memory time. Okay, so other options, very good, Jayan Abdin, very good for telling me that the option C was digoxin. See, remember, digoxin, we have an antidote called digibind. This was a question asked in the exam, or what we can give is digifab. Option D, if you are telling it's morphine, morphine as an antidote called naltrexone. And remember, morphine is a basic drug. If you want to remove that, you have to acidify the urine. So there also it will not help. So morphine is a weakly basic drug. Yes, very good. Many of you are adding the options. Very good. True about memantine. It's obvious. NMD antagonist. Now question number 15. So this is a question repeatedly asked. So that patient has deranged liver enzyme, which sedative is used? So the answer is clear, lorazepam. Any patient with liver disease and you want to use in a patient with chronic liver diseases or chronic alcoholic, the drugs we can use are lot. So these are drugs which we use for people who drink a lot. So L for lorazepam, O for oxazepam, and M for temazepam. So you can use them lot. Now why these are preferred? Because they don't produce active metabolite. So they are directly inactivated, that's the reason. Right? So the answer is C. Chronic smoker wanted to quit smoking. So what is the answer here? Varenicline, atropine, neostigmine, other things. So chronic smoker, obviously the drug what we use is varenicline. That is the answer here. Now varenicline, it's a nicotinic alpha 4 beta 2 partial agonist. So it is the one which is used for smoking cessation. Apart from that, the other drugs what we use is bupropion, and it's a NDRI. And we want to replace nicotine, so we have nicotine replacement therapy. There are two ways: the long-term prophylaxis, treatment, and the short treatments. Long is patch, and the short is what we have is gums, lozenges. So we have the gums, lozenges. Then what we have is the spray, inhaler. So the gums, lozenges, inhaler, spray. So these are the things. Okay. So 10th question, there was two options for one drug. In one option, acetazolamide for PCT. The acetazolamide, whatever they give, it is major action is on proximal connective only. Okay. Memantine, you try to recollect option, guys. So if you get it, then we can get answer for that. Question number 17. 45-year-old male, not on any medication, now diagnosed with diabetes, hypertension, and a grade 5 CKD with high serum urea and creatine. So renal failure. Patient does not wish to take insulin. What is the most suitable? Repeatedly asked question, linagliptin. So linagliptin is a DP4 inhibitor, and the drug undergoes exclusively bile elimination, and the drug also undergoes enterohepatic recycling. So because of this, there is no need of dose reduction in renal failure. So it's a direct question, linagliptin. Okay. So linagliptin is the direct question. Others are not used. Question number 18, rituximab. So it is rituximab. The name itself is telling you MAB. MAB means obviously it's a monoclonal antibody. It cannot be polyclonal. So it's a drug against CD20. It's a monoclonal antibody. So the answer is B. So why do you use rituximab? Rituximab is used in non-Hodgkin's lymphoma. It is used in autoimmune disorders like multiple sclerosis. It is also used in myasthenia gravis. Okay, so it's a clear-cut anti-CD20 drug. It's a monoclonal drug. The name is rituximab. Question number 19. Which patient with G6PD deficiency, which of the following drugs precipitate hemolysis? Chloroquine. Remember, when you think of chloroquine, think of two toxicity, eye and ECG. The eye problem is it causes corneal deposits in the front, back, bullseye maculopathy. And the second problem is it can cause, one is the eye problem. Okay, so we told you corneal deposit and bullseye. One more is ECG, that is QT prolongation. Primaquine is the drug which can cause hemolysis, particularly in G6PD deficient patient. Penicillin, the major adverse effect is allergy, and it can cause Zari-Charezima reaction if you treat syphilis with penicillin. Tetracycline, it's toxic. 4-toxic tetra means it can cause kidney damage, liver damage, it can cause photosensitivity, and it can also damage the bone and teeth. If used out in tetracycline, they can cause Fanconi syndrome and pseudotumor cerebri. They have anti-anabolic effect. They also cause allergy and diarrhea. So hemolysis in G6PD deficiency is obviously a drug by the name Primaquine. One more drug similar to that is tafenoquine. It is tafenoquine. What are the other drug which can cause is sulfonamides. So they can also cause hemolysis in G6PD deficient people. Okay, so this is the thing. Moving on to question number 20. I don't know whether this question was there, but some of them recalled and tell me. Artesunate plus sulfadoxine pyrimethamine combination is given for, obviously it is given in the treatment of malaria. Okay. Sir, question number 17, vildagliptin. So I think vildagliptin is not, was it given? Please confirm that. Linagliptin was what most of them told me. Okay, so what about 20th question, guys? Can you tell me? Palla Naveen Kumar, was it vildagliptin was given? Are you agreeing with that? Or linagliptin? So question number 21, which are the following true about anti-TB drugs? INH inhibits mycolic acid synthesis, true statement. Pyrazinamide is not such an inducer of cytochrome enzyme. You know, rifampicin is the major inducer. Rifampicin is not useful in other diseases, false, because rifampicin is used apart from TB, we use it in leprosy, we use it in meningococcal prophylaxis, Legionella, diphtheroids, and also it is used in MRSA. Yes, bedaquiline inhibits ATP synthesis. Yes, true. It's a inhibitor of mycobacterial ATP synthesis. So we have only two options which is correct, that is 1 and 4 only. So we can mark this. So if they have given linagliptin and liraglutide, so obviously the answer will be linagliptin only. So it's a repeatedly asked question, guys. So question number 17, liraglutide, linagliptin, if they are given, so obviously it should be linagliptin only. 20 was an image based question. It's okay, whatever image based question, if you identified the malaria case or whatever, so these are used. Okay. So which of the following increases trabecular outflow? Natrosudil is a Rho kinase inhibitor and it causes vasodilation and it increases trabecular outflow. Acetazolamide is a carbonic anhydrase inhibitor. Primordial is an alpha 2 agonist. And timolol is a beta blocker. So all these drugs, they decrease aqueous humor production. So it decreases aqueous humor production. So in all this option, this is the correct what we see. But if you have any other option, you can come back and tell me. Waiting for your opinions, guys. Okay, so if no issues, then we can move on. Okay. Which is a beta 2 agonist? The Dipivarin is a alpha 1 agonist. It's a prodrug. After metabolism, it becomes adrenaline, and that causes vasoconstriction and decreases aqueous humor. So we use it in the management of glaucoma. See, Brimordin also increased tubercle light flow. That is the minor action, Naveen Kumar. So the major action of Brimordin is to decrease aqueous humor production. So if I compare both, Natrosodil will be the best answer for us. Phenaldopam is a D1 agonist as well as alpha 2 agonist. So we use it in hypertension emergency. We use it in hypertension emergency. Mirabegron is a beta 3 agonist. So I have told you Mira means bladder. Mira bladder, it is used for overactive bladder. Dopexamine is a synthetic catecholamine. It's a dopamine agonist. And it's a beta 1 and beta 2 agonist. So because it's a beta 2 agonist, it has vasodilating property and also it is having bronchodilatory property. So the major use of the drug is in CHF. So the answer will be dopexamine because others will not match. Okay, so the answer is that. Okay, so tell me any discrepancies in this question. Okay, this was also multiple choice question. Okay. Okay, but the major action of dopexamine is B2 agonism and mirabegron action is mainly beta 3. Okay, let me consider that whether it is multiple or not. Oh, which all had beta to beta agonistic action. So that means mirabegron will also have that because mirabegron acts on beta. Phenaldopam action is on D1 and alpha 2. Dipivarin action on alpha 1. So mirabegron is a beta agonist. Okay. There was an option with A and D. Okay. So dopexamine, you all agree. So what was the option A? Because it's all recall based, I am not getting that. Okay, so we'll get back. Okay, once I collect these questions, I'll get back with this multiple. Okay. Now, getting back to the question, oxcarbazepine is better tolerated than carbamazepine because of less adverse effect. Which less adverse effect? The oxcarbazepine, it is comparatively less hepatotoxic and less rash. So please tell me whether they both were in the option. But oxcarbazepine causes more dilution hypernatremia compared to carbamazepine. Yes, epinephrine also acts on beta 2, guys. If they are given epinephrine, that also acts on beta 2. So you can, if they have given A and D, so if they want to ask you, Diphephrine is converted into adrenaline. So adrenaline can act on all the receptor. So if they have given multiple option and beta 2 they want to ask you specifically, then also the answer will be correct. A and D, that is what you told, 1 and 4 can be a thing. Okay, so that we can take like this. 1 and 4, if they have given A and D, we can take like that. So Jasir has given the answer 1 and 4 because diphephrine becomes adrenaline. Adrenaline can act on all the receptor. We can take like that. Okay, so what was this for? Oxcarbazepine is better tolerated than carbamazepine because of what? Less adverse effect. So hepatotoxicity is obviously lesser. Even the allergic manifestations are lesser with oxcarbazepine. Okay, if they ask you more adverse effect, okay, see, this is a discussion part. If they have asked like that, we'll give. See, compared to oxcarbazepine has more problem of dilutional hyponatremia. Compared to carbamazepine, they have more dilutional hyponatremia. If you want the answer here, okay. So it is compared to oxcarbazepine has less allergic manifestation, less drug interactions compared to that, because this has less enzyme induction property, so interactions are less and less hepatotoxic. So yes, thrombocytopenia, because that is also seen with carbamazepine, but that is also lesser with oxcarbazepine. All the adverse effects are lesser. The only adverse effect that is more is dilution hyponatremia. So you have to decide on that, guys. Okay. Now moving on to the question number, new drug application is done after which phase of clinical trial? Was it asked? NDA, new drug application. The new drug application is done after which phase? Was it asked? Now remember, whenever we start a drug, we start with a source, then we do the animal study. So once the animal study is done, we apply for IND. So IND stands for investigational new drug. Once that is done, we start with phase 1, then we do phase 2 and phase 3. Once you are done with phase 3, then we go for new drug application. So once you give this application, they will get marketing license. So once the company gets a marketing license, so we go for phase 4 trial. So this is the timeline what we do. And new drug application is done after which phase of clinical trial? Obviously after phase 3, we are going with that. Okay, phase 3, after that, we apply for new drug application, get a marketing license. Then the phase 4 is done, that is called post-marketing surveillance. Okay, so that's the one. Topical anti-glaucoma drug dorzolamide, what's the mechanism of action? Yes, it's a clear-cut answer. It's a carbonic anhydrase inhibitor. It's a carbonic anhydrase inhibitor. The name is dorzolamide. I think this graph was asked, as most of them told me, which class antiarrhythmic are this? The black line represents the normal action potential duration, and the red line represents the antiarrhythmic class. So basically, this is the slope, and we call this slope by dV by dt. So remember, if the slope is decreased moderately, and along with that, if the action potential duration is increased, so what are these drugs? These drugs are class 1A antiarrhythmics. So class 1A antiarrhythmics, they decrease the slope moderately. Right? The slope is decreased and the action potential duration increase. Why they increase the action potential duration? Because they also block potassium channel. And they block the sodium channel. That's why the slope decreases moderately. right? So it's a class 1A antiarrhythmic. So was it asked? Just analyze class 1 antiarrhythmics. So post-marketing surveillance was done in which phase? Obviously, it's phase 4 trial. Yes, if they have given quinidine, yes, obviously quinidine is a class 1 antiarrhythmic. So that will be the answer, guys. Very good. Okay, we discussed this in the class. Yes, very good. Okay, drug names were given. That is fine. So this is one more question which I just want to ask you. In a trial, as I got the questions, 4 to 5 patients. I don't think 4 to 5 patients are involved to be taken to find efficacy of a new drug. Half are given new drug and half placebo. Both patient and researcher were blinded. Which phase of trial is this? Tell me, guys. Any changes in that we can do and then come to this. Okay, so if you are using a blinded trial, usually what we do is phase 1 trial, we take human healthy volunteers, and here it is an open label study. That means patient knows what he is taking, whether he is taking the real drug or he is taking a placebo drug. So human healthy volunteers, and the major thing what we do is we check for safety and tolerability. So we check for safety and tolerability. Now, what is phase 2? Phase 2, we do it in the patient. So when you do it in the patient, we take less number. Okay, let us take 3 or 5. But what we check here is efficacy. And we take the real patient here and we check the efficacy here, and we do it in 1 or 2 centers. 1 or 2 centers. Now what we do in phase 3, we also take the patient here. Now don't worry about the numbers now. Patient, we check the efficacy. But here we do it in multiple center. Multiple center. So in phase 2 and phase 3, we use patient with a new drug and placebo, both are done. So if they are given 1 or 2 centers, obviously it goes for phase 2. If they have given multiple center, it goes for phase 3. So you have to tell me that. Multiple hospitals are involved, it will come towards phase 3 only. Okay. And both phase 2 and phase 3 are blinded trials only. Patient will not know, the researcher will not know, the doctor will not know. Both are blinded and we randomize them. Okay, so depending on that, phase 4 is obviously, it's again an open label study. We don't do blinding here. And so obviously we are stuck up with 2 options, phase 2 and phase 3. Okay, this is what we do. In both the cases, we take new drug and placebo and compare. So you compare the vaccine trials, what went on. So we are doing it in 1 or 2 centers. It is phase 2. Why do we do it in limited center? Because we want to confirm whether drug works or not. Then when the drug works, then we confirm in the larger population. Suppose the vaccine came from US. So I cannot take the same vaccine here. I want to check it in large population, multiple centers. Then only I will go for the marketing license. So that's why. Sachin, that's what more. See, sometimes what happens, some rare diseases you cannot find. For example, you take the example diabetes. Diabetes patient, you can get thousands of patients. But you want to do a trial on amyotrophic lateral sclerosis or some rare disease, how many patients you will get? Whatever phases they are, how many patients you will get? So practically not possible. Common disease, you can get thousands. A very uncommon disease, you want to check a drug, new drug. How many? Myasthenia gravis, how many patients will get? Or a patient with paroxysmal nocturnal hemoglobinuria, how many patients will get? So maybe because of that, so I am telling you the fact, this is what we do in trials. So because being a member of ethics committee, I know what we do in phase 1, phase 2, phase 3. We do it in our hospital. So if they are doing it in multiple center, so this is the point. So yes. So which drug used preoperatively to decrease blood loss during thyroid surgery? So propylthyrosol, propranolol, verapamil. Now you all know that potassium iodide, sodium iodide, Lugol's iodine. So Lugol's iodine is made up of uh, it's mainly made up of 5% of 10% of potassium iodide and 5% of iodine. So Lugol's iodine or potassium iodide, sodium iodide, they are the fastest acting antithyroid drug. Now they are given pre-operatively. Why we give it pre-operatively? To decrease the gland size, to make it less vascularity. So I'll write like this. These drugs are given pre-operatively to make the gland less vascular. So the thyroid gland becomes less vascular and it will become firm. So because of that, less blood loss. So less blood loss means more clear field of surgery. So these are the reasons why we use iodides pre-operatively. Okay, so obviously potassium iodide is used pre-operatively. This is the thing. Propranolol, see, nobody uses propranolol before surgery. Have you seen, suppose you are doing a hernia surgery, to decrease the blood loss, do you use propranolol? Yes, so this is a research they have done and this is being used so many days. So iodides are given pre-operatively to make the gland less vascular, firm and less blood loss, and less blood loss during surgery, more clear field and less chance of thyroid storm. Parathmetal, if they have asked quinine and ibutylide, in them what is sodium channel blocker? Obviously the quinidine is a sodium channel blocker. Ibutylide is a potassium channel blocker. Okay. Yes. So drug used in dyslipidemia causing gallstone, PPR alpha agonists, they are called fibrates. So fibrates, particularly the clofibrate, it has shown to increase the risk of gallstones. It will cause gallstone, fibrates. Statins, myopathy, niacin, you know that they can increase the risk of diabetes, they increase uric acid, flushing, itching, and these are the problems. Bile acid binders, main problem is constipation, that's it. So obviously the drug which causes gallstone. So one more drug which can increase risk of gallstone is the octreotide. Okay. So most of you told that mechanism of action of antiplatelet drug was asked, was it GP2B3 antagonist? I don't know. If they are given this GP2B3 antagonist, so the answer should be either abisiximab, tirofiban, then eptifibatide. So please comment on this. Was it asked? So what was the mechanism that was asked? If you want P2Y12 blockers are prasugrel, then we have clopidogrel, cangrel or ticagrelor. Yes. Okay, image-based question, whatever it is, GP2B3 antagonist, P2Y12 blockers, peer antagonists are atopoxar, and then oropoxar. Drug which decrease thromboxane is low dose aspirin. Okay, maybe they are given eptifibatide. Okay. I think most of you would answer that. Okay, parathmetal, if it is telmisartan, you can shift a patient to telmisartan. So patient having that telmisartan, the advantage is it's a PPR gamma agonist, so which is useful in a diabetic patient, and also it is longer acting. If they ask you the alternative drug, losartan, alternative drug, you can use telmisartan. But I don't know the exact question here. Okay, if they have asked that, you can go with telmisartan. The only reason is longer acting and PPR gamma agonism. That's it. But if they ask you how do you manage the diabetes, then you can come with the answer metformin. Okay, the drug which decreases thromboxane is aspirin, and eptifibatide is a GP2B3 antagonist. Prasugrel is a P2Y12 blocker. So depending on that, your answer should come to the picture. Yes. So that's what I am telling you. I am telling you whatever the question is, I am giving you the option. Alternative, if they are given telmisartan, I will shift telmisartan only. If they want treatment, there was only option metformin. You can give it. Okay, so then telmisartan would be the one which the Arjun is telling. Very good. Okay. Okay, patient has hyperkalemia. Which drug to stop? Patient has hyperkalemia. So can you give me the options, guys? Which drug to stop? Can you give me the option for this? Okay, waiting. So drugs for delirium tremens, they told multiple correct options. Yes, obviously we can add thiamine. Sedate a patient by using diazepam. Multiple options if they are given. Thiamine diazepam would be the answer. So if they had asked Nibin meiosis, how does it manifest? Who causes meiosis? M3. So M3 receptor is present in sphincter pupillae, and remember M3 receptors are the GQ couple receptor. So GP couple receptor, they activate IP3, and IP3 causes calcium release, and that will be responsible for contraction of the sphincter pupillae. Which second messenger? It's IP3 because if it is M3. Okay, options for a patient with hyperkalemia, which one to stop? If you have furosemide, itself causes hypokalemia, so no need to stop it. Amlodipine doesn't interfere with the electrolyte much. So losartan, if it is there, losartan is a ARB which increases potassium, so you can stop it. And we have told you in the class also, contraindications of AC or ARB is hyperkalemia. Okay. So any other questions? I think drug of choice for delirium tremens was asked. Okay, so I'll be waiting for any other queries from you guys. So metoprolol can also cause hyperkalemia, but if it is multiple, you can choose losartan, metoprolol. If you want to choose the best one, I will go with losartan only because they cause more hyperkalemia. Yeah, Aditya Raman, but I'm not getting the exact question, so I cannot comment on that. Yes, sequence of drugs in status epilepticus. Obviously, the lorazepam, then phenotine, phenobarbital, then the general anesthetics. So that can be used. So sequence of drugs in status asthmaticus. So did they ask you the viability graph in viability question, which drug has 100% viability? Finasteride question was there. So what is the question, guys? Finasteride. What was the question? Mechanism of action of what? So mechanism of action of finasteride is inhibition of 5-alpha reductase. So it's a repeatedly asked question. Sildenafil I have discussed, Priyanka. It increases cyclic GMP. Finasteride we have discussed. Okay. Okay. Metronidazole high effect. What was the question asked? Okay. Question about dose response curve. Okay, guys. So there were other questions which are remaining. So what I will do, I will try to compile and we'll come with a new video with that. So you can post your questions here. Okay, guys. So I will try to compile the other questions because without the full question, it's very difficult to answer these queries. I okay, I'll try to get those questions and get back to you. So these are the questions I could get from you all, and thank you all for your feedbacks and whatever questions you asked. I will try to put them in the YouTube this thing videos below that. So thank you all, and I wish a very good luck for your upcoming results of INI-CET. And hope, I think no new drug was asked, so that is the best thing, because new drugs, the MAB, the immune checkpoint inhibitors, they were not asked. Mechanism of action of digoxin was asked, very good. Epidural matching question. Okay. So thank you all, and we'll meet soon. Take care. All the best for your exams and NEET PG, and all the best for your results of INC. Thank you all. Take care.